Well, thanks a lot for staying with us here on Sunrise Live on E on this Hope Day Wednesday. Now, the Phelophepa Health Care train, established in 1994, initially operated with only 3 eye clinic coaches. By 1995, recognizing the need for a wider primary healthcare base, it expanded its services to include more comprehensive optometry, dental, as well as psychological care. So after 23 years of existence, the Phelophepa has grown to really many areas. And to talk more about the initiative, we're joined in studio by Operations Manager Onke Mazibuko. We invite you at home to participate in our conversation. Remember that number to dial is 011 4471 742, alternatively 2570, and will also be available on Facebook and Twitter. Thank you so much, Onke, for joining us this morning.
Morning, Faith.
Now, one would say that, the fact that you guys are operating in 8 out of the 9 provinces was quite strategic on behalf of Phelophepa, looking at the facilities that are available within the Gauteng area in itself, so needing to expand. So how are you guys faring so far, 23 years on?
I think the project has grown, certainly, because for many years there was only one train, and the second train was launched in 2004. And the way that the model works is that one train will visit 4 provinces. So when the time that we had just one train, we found that we were only returning to the same province every second year. So since 2014, we've been able to go to the 8 provinces we operate in every year. And I think that just shows the need that is already there, because as much as we go to some of the same stations over and over, we usually get requests to visit other stations which are nearby the ones which we generally do visit. So as long as there's people out there, the need will always be there for these services.
How do you identify the various areas to meet? And I'm saying this because South Africa really does have a lot of regions, as well as municipalities, as well as a lot of rural areas as well. So the outskirts there, how then do you decide we're going to go to this area and really put focus here instead of this area? So where do you identify, or how do you identify that need?
I think because of the model we work on, Transnet is a freight rail company. So we use the railway lines that have been built by Transnet over the years. So you'll find that there are many really remote areas which we can't get to simply because there's no railway line infrastructure for us to get there.
Yeah.
Or you might find the station where we need to stop can't accommodate the 19 coaches of the train. So in that sense, we are limited in terms of where we can go, but we generally do not go to places where we're going to be operating in isolation, because at the end of the day, the trains are there as a supplementary service to help the Department of Health. So wherever we go, we need to make sure that we have a referral base and we have a resource base that we can use. So
I'm actually looking, while you're speaking, I'm actually looking at the visuals on our screen. They're just showing you how is it that Phelophepa actually operates in itself there as well. So you're speaking about how you need to be at places where there is a railway line,
Yes.
and obviously and is able to capacitate. So then how then do you start encouraging those individuals and those who are within the region who can't necessarily be close to it? How then do you make sure that they get the message across that, hey, Phelophepa is right there in your area,
Yes.
be sure to come on board? How do you get that message across the communities?
Well, the project operates for 9 months of the year, from January until September. So October every year, we always have planning sessions with the institutions that provide us students, with our sponsors and all the other stakeholders which play an important role. And amongst them are what we call the social mobilizers. So in every province, we have a social mobilizer who's contracted to ensure that everywhere we go, people will know that we're going to be coming on whatever dates that we're going to be there.
Yeah.
And they need to make sure we have a resource list. They need to identify the people that are volunteers that work with us on a short-term basis. So there's a lot of planning that goes into it, and this happens as many as 3 to 6 months before the train actually arrives in a particular area.
And then looking at just some of the needs that have been identified there as well. I mean, one would say that Phelophepa perhaps is a better option as opposed to going into the long queues, in whether it's a hospital or a healthcare facility, etc. So in terms of receiving that base, is it growing? Are you finding that more people are choosing to wait for you guys to come into their area so that they can get their needs attended to?
I think definitely, Faith. You'll find that even with us, we have long queues, because in some places people sleep outside the train waiting for services every day.
They sleep outside the train?
They sleep outside the train. Sometimes if the train arrives on a Saturday, but we open the clinics on a Monday, you'll find that already from Friday, Saturday, people are sleeping outside waiting for services. And I think it's what I said earlier on about the need, that wherever there are people, you find that these services are still being needed by people. And wherever we go, yes, there are existing clinics, and we just say we're there to support the existing clinics, and we're not there to take over any work that they're already doing. And because we operate on a primary healthcare model, you'll find many of the services we offer the same as what you'd find in a clinic within those communities. So we work as a support structure, going in there to provide like a relief, if I can say that, to take the pressure off the existing facilities in the area.
Well, you're speaking about taking the pressure off as well, but when you're looking at the fact that you guys are actually, I can't say incubating, but you use the services of those that are in their final year in school. So those medical students that are their final year, optometrists, or whether they're in dental care, etc., they come on board, even psychologists, they come on board and actually have this as part of their community service. Is that correct?
Yes, that's correct.
All right, so when we're looking at that, how are they faring? Because one would say that they need a lot of patience, especially when it comes to the pressure that they overcome or they have to overcome in healthcare facilities and institutions that are currently existing in the country.
Well, I think it ends up being an amazing experience for the students, because, and I speak because I was a student on the train myself when I was doing my master's in psychology. And I think because we take final year students who are working under supervision from the Phelophepa staff, it's an opportunity for them to see cases that they would never see in the urban areas. Obviously the sheer number of people that are there also boosts them in terms of the number of patients that they see. So a lot of students, it's competitive for them to want to go on the train because they see the value of the experience that they'll get and the exposure. Many of them may never work in areas like that ever again. And then at the same time, it also gives them that value of why it is they decided to become healthcare professionals, which is helping people and being involved in a humanitarian project. So I think from that perspective, there's a lot of value in the project. I think when Transnet came up with the project, it was about helping patients, but nobody saw the spin-off of the value it would do for the students and the universities who have been with us since the very beginning and continue to support the project.
What challenges do you guys, get confronted with? I mean, I'm just thinking of a project of this magnitude that has to make sure that it's within 8 provinces, that year on year people do get that supply of healthcare.
Yes.
What are some of those challenges that you get confronted with? I'm just thinking in healthcare institutions, people say we run out of medicine.
Yes.
Point blank. There's no medicine or there's no doctor at that specific time.
Yes.
So how then do you guys identify your challenges and how do you overcome them?
I think the main thing we wanted to ensure with the project was that we don't experience the same problems at the Department of Health in terms of maybe staff shortages or resource shortages. But because of the model, I mean, it's very difficult to be constantly on the move all the time. So in terms of trying to reach as many people as possible without taking a particular community for granted, that will always be a challenge. And a lot of people ask, why don't you stay longer in certain communities? And while we'd like to do that, then you get calls from other areas saying, why don't you come to our areas?
The demand is simply too high.
Yes, the demand is simply too high. And I think when it was one train, it was obviously more challenging, but now with the second train, we're able to reach more people. And if it was up to me and we're living in an ideal world, I'd say there should be a train for every province, because that's just how much of an impact the project makes. And I think,
how do you get more trains? Okay, let's speak about growth now, because we've identified the challenges, we identified the areas, we know that it's a service that is needed, especially given the fact that it covers an array of services, right? How then do we start expanding from 1 or 2 trains to 8 trains in 8 different provinces, for that matter? Okay, how you guys putting pressure on Transnet? We keep mentioning Transnet's name on this platform, but how are they coming to the party and ensuring that you guys are assisted with the trains?
Well, I think Transnet has sort of been like a leader in the sense that they have set the example by building this model. And Transnet also recognizes that, well, Transnet can't work alone in this, so Transnet's working with the Department of Health. Then we also have sponsors who have come aboard and are always saying to us they are willing to support any further thinking.
So then my question then comes back to you and saying, have you guys championed so that that further thinking can take place? Because there's a clear need, right? You guys are solving a problem in this country, right? You cannot tell me it's easy to operate on just 2 trains, right? So how are we capacitating, and what's the role of those organizations to capacitate you guys so you can do your job effectively?
Well, as I say, in the past 6 months or so.
Give me an honest conversation here.
I'm giving you an honest conversation. In the past 6 months or so, we have gotten a lot of outsiders wanting to come to the train to learn about the model so that they can do something else, either in Department of Health, take social services out there, take Department of Labor. So again, I think in terms of setting an example, people are talking about what can be done. Now, a new discussion that's also happening is, okay, we see this primary healthcare model, but now that we're spreading ourselves wider, we're identifying further problems in that we are referring back to the same system that's overburdened because we don't do, for example, cataract operations. We don't have surgeons and doctors on the train. So the ideas come up now, why don't we build a surgical train?
Okay.
Similar to the one that they have in India, the Lifeline train that they have there. So the discussions is there is what I'm saying, and it's a constant process of trying to improve the services. Transnet hasn't just built this project and said, okay, this is it, we're sticking to it. It took many years of planning for the second train to come out, and it was as recently as 2014. So I am confident that at least where Transnet is concerned, the discussion is open to how can we further grow this project.
Put pressure on them, Onke. Put pressure on them. We want to see 4 trains or 8 trains within the provinces themselves.
Look,
we're agreeing with you.
I agree. I agree.
Well, thanks a lot for joining us this morning. I definitely
you,
want people to go onto the website. Do you guys have the Phelophepa website?
Yes, it's on the Transnet main website under the CSI division, Transnet Foundation.
Transnet Foundation. Then they'll be able to find more information about Phelophepa there. Get it behind it. Get involved if you're a volunteer. If you're even a medical student and you want to assist, as you see here, you get to go to places that you never would have ordinarily traveled to. Transnet Phelophepa Health Care Operations Manager Onke Mazibuko joining us this morning, shedding some light into the Phelophepa initiative.